This is the Daily Medical News by MD Edge, where we bring you the top stories in clinical medicine, followed by a deeper dive into the day's top story. Today is Monday, November 11th. I'm the voice of MD Edge Podcast's Nick Andrews. All of the stories you hear today are available in full written form at mdedge.com, and you can find the links to the individual stories in the show notes. Coming up later, a closer look at a federal judge's ruling against allowing clinicians to refuse to provide medical care for patients based on religious or moral reasons. But first, we'd like to ask for your help in making this podcast better. Please take a moment to complete our short listener survey by following the link in the show notes. Questions include a little bit about you and a little bit about what kind of podcast material you like. We would greatly appreciate your feedback, and of course, this survey is anonymous. Before we begin today, on behalf of MD Edge, I'd like to pay my respects to all of those service people out there, especially those who are treating patients in the field, treating patients at home, and all of those working at any Veterans Association healthcare facility. Thank you for your service, and thank you for your care, and thank you for being here. And now, the top stories in clinical medicine. We begin today with an update on how vitamin D and omega-3 fatty acids impact kidney function in type 2 diabetes. A new study has found that neither vitamin D nor omega-3 fatty acids are significantly more beneficial than placebo for the prevention and treatment of chronic kidney diseases in patients with type 2 diabetes. This is according to research presented at Kidney Week 2019 in Seattle. In the study, researchers randomly assigned more than 1,300 patients with type 2 diabetes to one of four groups. These groups were vitamin D plus omega-3s, vitamin plus placebo, omega-3s plus placebo, or placebo plus placebo. In an accompanying editorial, Dr. Annika Lucas and Dr. Miles Wolf wrote that this study had nearly normal mean 25 hydroxyvitamin D levels at baseline, which leaves open the question of whether the results would have differed if the recruitment had been restricted to patients with moderate or severe vitamin D deficiency. However, they also wrote that it seems safe to conclude that the previous associations between vitamin D deficiency and adverse health were driven by unmeasured residual, confounding, or reverse causality. And the diagnosis and treatment of obstructive sleep apnea resulted in medical cost savings in a group of U.S. truck drivers. In the study, researchers looked at records for just over 1,500 drivers who were tested for obstructive sleep apnea. Of those 1,500, a little more than 1,200 tested positive. The researchers compared these patients with an equal number of controls. The investigators then looked at insurance costs for diagnosed drivers compared with screen-positive controls before and after polysomnogram date over an 18-month period. The researchers found that non-apnea-related medical claim costs savings after diagnosis and treatment over every 100 screen-positive controls was $150,000. The study participants who adhered to treatment with APAP saw an average non-apnea-related savings of more than $400 per month. A prime boost hepatitis C vaccine regimen did not protect against chronic infection. However, it did evoke immune responses and differences in viral trajectory. This is according to what may be the first ever randomized placebo-controlled efficacy trial in this setting, which was presented at the 2019 annual liver meeting in Boston. The phase 1-2 trial included 455 adults who were at risk of hepatitis C virus infection because of injection drug use. The participants were randomly assigned to vaccine or to 2 doses of placebo at day 0 and day 56 of the study. The vaccine consisted of a recombinant chimpanzee adenovirus 3 vectored vaccine prime plus a recombinant modified vaccinovirus Ankara boost. They report that there was no difference in chronic HCV infection at 6 months, the primary endpoint of the study. There were 14 chronically infected participants in the vaccine group as well as 14 in the placebo group, which is an overall incidence infection of about 13 per 100 person years. However, the researchers found that there were significant adherence in HCV RNA geometric mean peak at 1 month. A total of 78% of vaccinated individuals had T-cell responses to at least one vaccine antigen pool. The investigators also added that the vaccine was safe, well-tolerated, and not associated with any serious adverse events. The Daily Medical News will be right back after this. And welcome back to the Daily Medical News. I am Nick Andrews. Lung cancer is on the decline among both males and females, but men have a ways to go to catch up with women. This is according to data from the CDC published in the Morbidity and Mortality Weekly Report. From 2007 to 2016, rates dropped among both sexes in metropolitan and non-metropolitan areas. However, lung cancer incidence in 2016 was still 40% higher among men than among women. In the report, researchers wrote that rather than narrowly focusing on just stopping smoking, a comprehensive approach to lung cancer prevention and control includes such population-based strategies such as screening for tobacco dependence, promoting tobacco cessation, implementing comprehensive smoke-free laws, testing all homes for radon, and using proven methods to lower high radon levels and reducing exposure to lung carcinogens such as asbestos. According to the authors, increasing the implementation of these strategies, particularly among persons living in non-metropolitan areas, might help reduce disparities in the decline of lung cancer incidence. And finally today, a federal court has struck down a Trump administration rule that would have allowed clinicians to refuse to provide medical care to patients for religious or moral reasons. In a decision on November 6, 2019, the U.S. District Court for the Southern District of New York vacated President Trump's rule in its entirety, concluding that the rule had no justification and that its provisions were arbitrary and capricious. District Judge Paul Engelmeyer wrote that the U.S. Department of Health and Human Services did not have the authority to enact such an expansive rule, and that the measures conflicts with the Administrative Procedures Act, Title VII of the Civil Rights Act, and the Emergency Medical Treatment and Labor Act. Judge Engelmeyer wrote that had the court found only narrow parts of the rule infirm, a remedy tailoring to the vacanter, the only probable provision might well have been viable. The conscience rule, as it is called, was finalized in May of 2019 by Health and Human Services. The bill would have allowed clinicians to refuse care to patients if they deemed that care was in conflict with their religious or moral beliefs. The provisions principally addressed objections in abortion sterilization and assisted suicide, as well as counseling and referrals associated with such services. The judge's orders invalidating the rule consolidated 3 legal challenges against HHS over the rule. Plaintiffs included more than 15 states, Planned Parenthood Federation of America, and the National Family Planning and Reproductive Health Association, among others. The plaintiffs argued that the rule would have threatened the ability of clinicians to provide essential, potentially life-saving medical care and would have exacerbated health disparities. The court's decision comes less than 1 week after another district judge temporarily blocked an order by President Trump that would have made having health insurance or the ability to pay for medical care a requirement for immigrants seeking U.S. visas. In that case, the judge said that there were serious questions about whether President Trump's immigration rule was arbitrary and capricious and therefore a violation of the Administrative Procedure Act. That order is on hold while the case continues through the courts. And that's it for this edition of the Daily Medical News. Remember, you can read more about each of these stories by clicking the relevant links in the show notes. For MD Edge, I'm Nick Andrews.